where do we start? Very well educated from some of the best universities in the world, served the UN, owns a shipping company, and now has moved from the US and has started off a dream project. Tell us about your journey as a social entrepreneur and how and where did all this start?
Thank you, Dr. Ram, and thank you for the kind words and for giving me this opportunity. I'm very happy to be here and be talking about my journey as a social entrepreneur today. Before that, so the objective of today's meeting, as we were discussing, Dr. Ram, earlier today, is basically, of course, to give the students, a view of my journey, but also to tap on what really social entrepreneurship is and what are the various avenues one can look into and what are the differences between social entrepreneurship and a business entrepreneurship or a non-for-profit company. So with that in mind, I'd like to address the definition of who a social entrepreneur is, right? The word social, when we talk about social, we think it's like a non-for-profit or an NGO in India. That's the word that's used here, or something that, you really often don't make profit out of, but and that's the main difference essentially is social and entrepreneurship. So it's basically making a social impact by doing business, right? So so just to break that word up, so there's the business entrepreneurship, which is basically that looks at profit making. Social entrepreneurship does also look at profit making, but with having a social impact or making an impact for a developmental cause. And of course, in an NGO, it's purely philanthropic. So how did I start my journey? That's a very broad question, but I think I can take it back to my school days. Really, I've always wanted to make an impact in the community. Growing up in India and in Mumbai, you see so much of disparity with, kids from slum communities who don't have proper education or housing, and you're living in your bubble in cars and going to school, and then you see, the same age group of people suffering, and really how they have. So the big question growing up is why is there so much disparity? And that always was the burning question I had. And how can we reach out and make the world a better place, of course, as I grew up. So from school days, of course, from after school, tuitions for underprivileged kids, I went on to working with a lot of non-for-profit organizations in India. I was primarily working on slum intervention programs with youth for youth education. I was working on HIV/AIDS prevention programs in the early 2000s when the HIV epidemic hit India very badly. We worked a lot on child rights. So the journey actually started for me in India, where I was working on various slum intervention programs, and then I went on to pursuing a degree in public health. Well, prior to that, I also, applied a lot of what I learned in my school as a psychologist to design behavioral programs and interventions to see how we can educate the community. And my second degree, I learned a whole lot on how to actually make an impact at a larger level, and that is public health. So I am going to touch upon these definitions just to sort of integrate and tell you my journey, how I came to be. So I applied to schools, and I got in a good program at the University of Michigan, and I also had the opportunity to study at the Ross School of Business. And back then we had this really cool professor, C.K. Pralhad, who actually developed the bottom of the pyramid protocol. It's a corporate strategy, which I learned in school, which basically looks into this economic pyramid. And in the pyramid, he says that the fortune lies at the bottom of the economic pyramid. Now, all my life, growing up as a teenager in my early 20s, I worked in India with so many development projects in slum communities and with youth, with women, and on women empowerment and education. But it was always with this, the not-for-profit, you get funding somewhere and then you apply it. But it was not, so for me, the larger question then became that what happens when the funding ends? I mean, do we stop? Do they get back to where they are? So is there a continuity? What about sustainability? And this is something that I learned in school at the University of Michigan. And so I had the privilege to study from the Ross School of Business, as well as, study public health management systems. So public health, by definition, is basically looking at the larger health system. And public health, the basic philosophy there is, as a public health practitioner, we feel that prevention is better than cure. So we want to nip it at the bud. So even with cases of COVID, for example, right? You would want to exercise all the rules of, stay at home, so that, you don't increase it rampantly. So on and so forth with the various sectors. So public health, having worked firsthand in India with all these on all these community development projects, I was able to apply a lot of the public health concepts and theories that I was taught in school on psychosocial and economic impacts and behaviors. And then I realized that, and then from the Ross School of Business, I learned about how, coming back to the corporate strategy. So public health, and then I'm sorry, I diverted a bit. I was coming back to the Ross School of Business, is a strategy on this economic pyramid. So at the bottom of the pyramid is where the fortune lies. This is what Professor C.K. Prahalad said. And he says that if you tap into that fortune, then you can really transform communities. What that means to me is that these people these underprivileged people, essentially, who have dealt with over the years, I realize that they have the same kind of aspirations, wants, needs, and they do have the capabilities and the capacities. They just don't have the means. And so how do you tie the means? And so logically, if you see that, so that's from a community development perspective. From the business perspective, it's like the business owners want to increase their consumer base. So how do you increase your consumer base? By actually having more consumers. But if you then empower these lower economic folks, right, they will then eventually become consumers. So then essentially it can become a win-win situation. So then we started thinking about, how about we integrate public health, the whole idea around the community development practice, whether it's health, whether it's your socioeconomic income, whether it's education, skill development, so on and so forth, to improve communities. I mean, the best example that I have and that I've worked on is in slum communities. So there's that one piece. And with the business side, it was basically appealing to the business owners, is that, how about if you give these folks jobs, they would then have the purchasing power to then become, come to a level where the economy grows, right? So applying that logic, we wanted to see what is a win-win situation. Can the businesses invest in local communities and societies and programs for any topic, right? I'm going to talk about sanitation today. So back then it was on, I was working in Ypsilanti, Michigan, and there was a lot of homeless people. So we essentially want to address the issue of homeless people, but also have fresh fruits and vegetables, produce, essentially, because in the United States, it's cheaper to get a bag of chips and your fries and not really your fresh fruits and vegetables. So we were looking at it from a health perspective. So anyways, having said that, so there's the public health umbrella, and then there is the business umbrella. And so we wanted to integrate social public health, which is community development, a different word, and then the business, and try and make it a win-win situation. And the larger mission was actually looking at sustainability, because what I realized, and coming back to my earlier point, is that when I was working in these non-for-profits, like every time the project ended, everything ended. You know, your salary ends, your job ends, those people go back to where they were, and what is that? You know, how do you kind of sustain people? So really looking at sustainability, where you can empower the community, you can ask them to take ownership for what they're doing, to empower their communities for whichever problem it might be. Right? And I'm going to give you the example of the venture that I have launched here in India. So having said that, okay, I'll continue with like, okay, so in India, I think I started my journey with, you know, having worked in India, then I studied, you know, at this great school, and then I got an opportunity at the United Nations. Within a month, I got an internship. That was a great foot in the door. And then I, you know, got a consultancy and then a job. So this was great. For me, the UN was a great start, you know, coming out of my second master's degree program and having learned like somewhat of community development projects. I wanted to learn about how do policies and the larger governmental organizations, right, apply this. So there are so many systems when you look at the healthcare system, you look at the private sector, you look at the non-for-profit sector, you look at the community in itself. And what I learned at the United Nations is like every bucket or pocket really matters. You know, one can't really work in silos if you really have to look at the well-being of a country, you know, holistically speaking. And in public health, is, of course, as a psychologist, you know, there was always that behavior hat. You know, how can you change human behavior? You know, to positive health communication, and there are a lot of strategies that were applied. So anyways, so at the UN, of course, at the policy level, the way the UN works is essentially, you know, you work with countries on addressing key problems. So back now, of course, we have the UN Sustainable Development Goals, and thank God there's the sustainable word. But back when I was in the UN, this was in early 2008, there was what we call the Millennium Development Goals. So I was part of the Health Millennium Development Goals, and I was focusing on maternal child health, HIV/AIDS, and so on and so forth. And coming from the community development, like, you know, firsthand experience with the community and the slum dwellers on their health and well-being, I realized at a UN level, they're mostly working with the governments, they're mostly working with non-for-profits, and maybe a few international NGOs like the Gates Foundation, and sometimes the corporates will come in. So this was a great model. Again, I'm like, oh my God, there's so many buckets here, and each one plays a role. And also the community. So the community that you're tapping into essentially needs to be a decision maker. So these are all decision makers, and these are all folks who wear different hats and different roles. So that was a fantastic experience for me. I was, you know, with the technical division, managing the portfolio of 120 country offices, you know, assessing their policies and programs and their targets. I was instrumental in helping design a policy for HIV/AIDS and prevention for sex workers. What are you know, programs for them and their policies. This was launched in Geneva back in the days. So when I was again in the UN, you know, I was coming back to the health MDGs. There was one goal which was really staggering, and that was that of sanitation. And we had these global targets, and it seemed that sanitation was still lagging behind by 75%. And I still remember someone sitting in the room, and they said that, you know, India, it's a shame that, you know, there are so many people defecating in India, you know, and they coined the term, India is the open defecation capital of the world. Oh my God, and that really hit me. I'm like, oh my God, that really sucks, right? Listen to that. And it's like open defecation. I mean, that in itself is is so inhumane. It's just like, where's the dignity? Where's the self-respect for all the women and the elderly people? And why is this still happening? And of course, I've also seen this firsthand, so I kind of knew this. And so I decided that, maybe it's time that I, connect with a few folks and try and see if we can do something about it in India. And of course, my journey through life. So that was the point where I decided this is sanitation is something that we can take on. And I graduated to working. I moved to San Francisco for personal reasons, and then I started working with another very great organization, the Research Triangle Institute, and I was instrumental in winning a proposal with the engineering team, the technology team, for the Gates Foundation. The Gates Foundation was funding a waterless toilet initiative. So I was part of, the social team that was going to try and implement this, and how do we go about implementing. So one thing led to the other. I think I had opportunities to also participate at the the World Bank Sanitation Hackathon, and that's when I started talking to folks in India, and I had come here to India. I organized a visit in India late 2015 with a bunch of parliamentarians to study on sanitation and housing issues, and we chose to also assess and look into Dharavi, which is one of the largest slums in Asia, and in Mumbai city, which is where I'm from. And that was a turning point for me. And then I said, okay, now we have the Swachh Bharat mission. It's a flagship program. The Prime Minister is promoting it. What a great cause. And this really needs to happen. And so when you're talking about 2.5 billion people who don't have access to toilet, and 880 million of those are residing in India. And I'm of course talking about maybe like 5 years ago now. So that's a huge number still. And that's an enormous task. So at the World Bank and all these these other organizations that I worked with, I designed a couple of programs and technologies, and I'd like to take you through that presentation. And do let me know if I should stop talking. I can get.
Okay, it was good to hear your journey. And meanwhile, I just want to probably quickly ask you this question, and if you've got the presentation also, you can go ahead with it. You've recently started two new ventures in India. One is an NGO and another one is a social enterprise. Is it the same or is it different, or what exactly you do there? Can you probably take us through that?
Right. Yeah. Sure. So I was actually coming to that. So thank you for asking me that question. So basically how it started, it's just the story. I came to India in 2015, and then I met with a bunch of social entrepreneurs who were working in the water and sanitation sector, and for my own selfish reasons, I chose the topic of sanitation to see what was really going on in India, both on the urban and rural side. And so we visited the ministry in Delhi, and then we went to Dharavi, and then we went to Chennai, met with a couple of social entrepreneurs. In fact, there's a lot of great work happening in Bangalore and Chennai, even back in the days on the whole sanitation system being improving. So yeah, I think I'll switch now to just focusing on the sanitation topic that you asked me. So I do have a non-for-profit organization that's called Sanitation Impact Solutions, which I started before my social enterprise, which is called Toilec, of the 818 million people who defecate in the open. And when I came here, I realized that the government is doing a lot to have toilets or build toilets in India. But whether or not they're being built the right way, or whether there's a follow-up program as such, that was uncertain. And by that, what I mean is, and this is something that I'm sure that most of us here will still empathize with, is that till date, public toilets, going to a public toilet in India is such an ordeal in most places. It's embarrassing. Like if you go to, except for if you're going to a mall here, if you go outside a railway station or even at a station, hygiene is severely compromised. There's more often than not, that some of these toilets, and I'm speaking of mostly in Mumbai and Chennai, where I've actually worked. It's more often than not, these toilets are, dirty, dark, dilapidated. They're smelly. There's no water. The flush is broken. The sewers are kind of overflowing, or like no one's cleared the trash, or like so there's the garbage that's overflowing, and half of these toilets are essentially locked. So we did an assessment of over like 350 toilets across rural, urban, and peri-urban areas. And we also noticed that a lot of the toilets that were built in the rural areas by the government, they were used as sort of storage rooms. So the whole supply chain system, or the whole operation and maintenance, was not really happening at that level. So that was always a concern and a frustration, as to, everything is really developing in India so smoothly, and, we're having more cell phones. There was this analogy in the New York Times a while ago that India has more cell phones than toilets, and, this whole idea of open defecation, and how can we tap into that? So that, yes, of course, we do need more toilets in terms of numbers and how we place them, how we design them, because even the designs have been so archaic, in terms of ventilation, in terms of the placement of where are they user friendly, whether you're talking about a slum community or a school, or in public areas. And in public areas, we mainly focused on public toilets outside railway stations so far, or parks, and we're looking at highways now. So in 2012, I participated in the World Bank Sanitation Hackathon. Our idea was very well received. It was featured on the Forbes, and it was basically an app model, which was a toilet maintenance system. So maybe perhaps I'll just, is there a way to share? I should just share the...
Yeah, you can do that share screen.
Yeah, I'll do that actually. All right. Okay.
Yes.
All right.
Yes.
Yeah. So toilet, yeah. So essentially, sanitation impact solution and toilet both focus on toilet development and management. So the idea and the reason being that we felt that the supply chains, there's no sort of formal supply chain system for the management of toilets and sanitation services. So of course, you look at a toilet, but then there are other services that are involved, which besides the municipality in cities, we don't really see much of a formal or a more standardized way of maintenance. So operation maintenance and things like your supply chain for managing these toilets were severely lacking. And even now, I think the government, of course, is doing a lot, but they started first with sanitation impact solutions, with the idea that, toilets are, that we were more interested in looking at the infrastructure that's already available and how they can be improved, rather than going ahead and building new toilets. And also the infrastructure that was available, can we revamp them and refurbish them? And so M-Sanitation was the first model or the technology around that endeavor, which we had first proposed in 2012 at the World Bank Sanitation Hackathon, which is basically a toilet maintenance app, or also what we designed as a toll-free number, an IVR system. So when we look at a toilet, and I'm getting into specifics now as to how we designed this, and you can tell me when to stop, Dr. Ram. I'll try and keep it brief, and perhaps just walk you through some of my the programs that we've done. So when we look at a toilet, what we noticed is more often than not, I was telling you, these toilets, are not very clean, or there's no water or electricity. We saw that, solid waste management or field sludge management was missing, and a lot of them were broken, and there was really not any repairs and construction happening. Social safety was another issue that we saw, especially with women, because they had to really, at odd hours of the evening or night or early hours in the morning, they would have to go walk like half a kilometer to get to a toilet. And they were often eve teased around where these locations were. So those kind of issues were also faced, or like, you know, the distancing or how these toilets were built and the bullying that happened. So we, in our initial assessment, we saw all of this. So we decided to then design an app working around this algorithm of these 5 or 6 issues that we faced. So yeah, that's the intro bit, who we are. So we're a toilet management agency. Of course, we talked about open defecation, so we want to try and remove that. We're focusing on improving the quality and access of public, community, and school toilets. And our mandate is to improve sanitation systems in developing countries, of course, India now. And our approach is to track, build, and maintain and sustain these toilets, and not just focus only on any one part. So this is our process. We track it, and then we build the toilet, or build the system around it, and then we maintain and sustain it. So we look into toilet management services, and I'm going to talk about all of this in a minute. We do a lot of community awareness programs and behavior change. We provide training and skill development of sanitation service providers. And then, of course, we build and refurbish existing toilets. So the first program was basically, it's just a simple model that why don't we just have a system wherein users who go to these toilets, public community toilets, you know, report a problem and, you know, open a ticket, and then the nearest local service provider, be it a plumber or a mason or, you know, a cleaner, fix the problem, report the fix. Because essentially what we also realized is at a municipality level or at a taluka level, which is in the rural areas, a lot of times there were workers, but there was no accountability as to ensuring a standardized protocol to maintain these toilets. So we thought that having a ticketing system model would allow us to also gather data of around the 5 or 6 key areas that we decide. So we very quickly first realized that you know, folks in India and the target population may not have, you know, smartphones. So we developed an IVR system in 4 languages, in Hindi, Marathi, English, and Tamil. And this is essentially the pictures that you're seeing is, you know, these, the number, you know, was put up, a toll-free number was put up with this poster on every toilet. And if they found an issue, they could report the problem. And then, of course, the loop would be that the provider gets the message and he or she has 24 to 72 hours to fix it and report the fix. So this is something that we tested out across the rural, peri-urban, and urban areas. And it was very well received. It was designed primarily, of course, for the municipality so that they could ensure accountability of the, you know, toilet maintenance, and also essentially see where the gaps are, and assign for any sort of funding that would be required, you know, whether it's, and more often than not, at least here in India, the issues were mostly around repairs and water, followed by, you know, cleanliness. So these were the main issues. And then, you know, so we talked then at a policy level on, you know, budget allocation and all of that. So I'm sorry, I'm showing you a few dirty pictures, but essentially, you know, there were ways where people could take a picture and they could report the problem, and they send a picture, and, or, you know, talk to the person on the toll-free number, or report by the IVR and report the fix. So this was well received by the municipalities. We did the pilot study in 2017 and 2018. And then we tried to assess what was the level of maintenance. And overall, there was only about 52% of the times that these problems were reported that, you know, toilets were getting fixed. So we tried to, address that accordingly. And this was the app, and then the app was the first design that we built. Is basically to report a problem, to rate a toilet, to see the nearest toilet. Then we also built another app around it to call your service providers, whether it's a plumber, a carpenter, a mason, electrician, or cleaner. So really looking at the supply chain. So that was our first solution to the problem of maintenance of toilets. So this was launched in Chennai, in Kanchipuram, in Mumbai. That's the mayor of Mumbai. That was our first program. The second program, I'm going to run through this. I think I'm just talking too much. Perhaps I can just get to more of the business deal, which came at a later. So this is all part of Sanitation Impact Solution, which was the non-for-profit organization. And in non-for-profit organizations, oftentimes you're working for a larger community with the government. And we were working in public schools and public toilets and slum communities then. While doing so, we realized that, okay, we have an app that helps track these toilets and maintain these toilets, but do we have enough service providers, and are they really doing a good job, and can we have a standardized protocol for maintaining these toilets? So we looked into then developing training programs, training and skill development for private toilet contractors, for cleaners in schools, for masons, for carpenters. And this was also a win-win situation, because essentially if you go to see, we're creating more sustainable jobs essentially across these buckets of whether it's having more cleaners or plumbers, and linking them based on the district or taluka they are in. This is how we went about. We first built a lot of awareness of what the situation was in their area. This was in Kanchipuram, and then we identified the issues, and then we went about recruiting interested folks. I mean, folks who've already been working as sanitation workers or are interested in jobs, and we got buy-in from the government. This picture on the far right are all private toilet contractors who got training on how to ensure that these toilets are well maintained, because essentially that's what we want, right? More business will come with better toilets and better hygiene. So creating again that model of business and making that social impact at all times. So this is a lot of training that we did with plumbers and with cleaners who wanted to be part of this. So that was our second real project on training and skill development towards the supply chain. And then we went on to working on operation and maintenance for WASH. WASH is the acronym given by UNICEF for water, sanitation, and hygiene in schools and ashrams. So here again, like if you look at government schools, this was in Thalassery, which is 200 kilometers away from Mumbai. This is the situation of toilets. And I've really not shown you a lot of the toilet pictures, which are really, really bad. But when you go to a school and you have students and you see this and you're like wondering, like, where do these guys go? I mean, okay, they're probably defecating in the open, and that's how you start. And do you want, kids at this age to do that? I mean, so anyways, we tapped into that. And this was a program that we did with the Ministry of Drinking Water and Sanitation. And it was very well received. I think it is being implemented now as we speak. So we're very proud of that. This was another venture that we did. So yeah, the same process of mapping and training. And then we launched Toilet, because with all this, we realized we worked with some toilets, we worked in school toilets, and then we started looking at public toilets in urban areas. We went from rural and peri-urban to urban. And we started looking at, like, why not look at revamping all our public toilets and looking at, having better version of toilets, whether it's at a park or a recreation center or outside a railway station. I mean, again, like I can speak for people like us, or like even my friends, we wouldn't want to go to a public toilet. We would rather go to the nearest Starbucks or a restaurant which has a toilet. So then our efforts were focused around really working with a bunch of design thinkers and architects and looking at creating the next gen version of toilets. And this is what we've started most recently, is looking at designing toilets, or which are sort of more high end on the exterior, but have the amenities and this is the social enterprise essentially. And so again, we are working here with the community. It's more jobs for your architects, your plumbers, your masons, your designers. There's more work, and there is a fee for service model, which is like 5 rupees minimal, I think, to to use the toilet, or 10 rupees to take a shower. So these are models that we've designed around parks. And this is at a highway, and we have one by the Andheri West Station. These are the amenities that we have, which is basically, we have your English and Indian toilets. Or even with Indian toilets, I mean, minor details of design, like having grab bars, because what if it's like an elderly person, things like that, having hygiene messages, and ensuring that sanitary napkins are not like shoved in the pot, but you have bins for that. So our new toilet model or prototype for a public toilet, this is what it would look like. This is a ladies' toilet, so it has a sanitary napkin vending machine, it has a shower area, it has a diaper changing station, and it's well lit, it's aesthetically sound, it has mirrors, and so on and so forth. I mean, it's really not nothing out of the box, but it's really taking care and going along with what we really need as we grow and progress as a society, and get more developed and advanced. And why should we discount on toilets? And things that I've not really covered is, of course, looking at the supply chain of solid-based fecal sludge management and how we sort of map cleaners. So that would be a broader discussion, but these are some of our proud moments of launching these toilets. And here is the model that I was telling you about. So in all this effort, and it's always been looking at it from a gestalt, right? It's everybody really has a role to play. So I mean, this is our ecosystem of folks in India. So if you're looking at the toilet example, right from the toilet users, we want to mobilize folks. I mean, this does not just happen by building toilets. Really, it has to be the ecosystem participating in this at all times, whether it's at the rural level or an urban level. So here we have your toilet users. We first went to the community. We mobilized the self-help groups. There are Mahila and Mitra Mandals, their community representatives, to ask them about. So there's a lot of work that goes behind user design. And then sanitation service providers. So there are caretakers, there are cleaners, there are plumbers, electricians, masons, construction workers, engineers, so on and so forth. And then when you look at toilet contractors, you're looking at the private contractors, and you want to mobilize the NGOs, the ULBs, and the sanitation enterprises. And at the municipal level, again, we had the smart cities program back in the days, and so we were mobilizing a lot of those folks. And then, of course, corporates and donors, how can we tie that in? And government, of course, is essential. So that's how we kind of, looked at it from the gestalt. How can we take best? And we're now a team of design thinkers. We have, folks from different areas. We have architects, we have urban planners, we have global health professionals, business development folks. So a lot of people have really been excited and participated in small ways. So these are just, pilot prototypes of what we really want to do going forward for schools, for, in public areas and parks and so on and so forth. So, and essentially applying businesses to it, because at the end of the day, it goes back to that same point that I was telling you, is that we want to create a win-win situation, not only for the community, but also for the businesses. Because if you have better health, hygiene, and so on, yes, doctor. Thank you, Dr. Ram. Thank you for the opportunity and